that says confidentiality is going to be respected, and he has no allergies, so that's not going to be a concern. And for this, he's not going to be up and about, so we've got safety things going on with the bed rails. I'm going to collect both subjective and objective data that will be used by the healthcare team to establish a nursing diagnosis with patient outcomes and nursing interventions. So to begin with, I'm going to look at Manny and see if I can recognize by facial expressions that he is experiencing any pain. I will ask him if he's in any pain at this time. He's probably a little short of breath because I forgot to elevate the head of his bed, and he has a trach, and so he should have his bed raised just automatically. So that will take care of that, and he doesn't seem to be anxious about the head-to-toe assessment process or his physical condition or family issues at all. I noticed immediately when I came into the room that Manny was a male. He was Caucasian, and he appears to be about 40 years old. He is well-muscled but not obese, and he has a below-the-knee amputation on the left side. His gait, I noticed there are crutches in the corner, so he uses that when he ambulates, and probably uses the three-point crutch assistance for that. He has been well cared for. He has on doesn't have his glasses on, but he has his teeth in, and all of the things that he would need to have to make him comfortable. He's pleasant. He's responds appropriately to the conversation that we've had so far, and his speech is distinct and not slurred. I'm going to begin with the neurological assessment. And again, he's awake, he's not drowsy, he is not unconscious. I've asked him, can you tell me your name? And he says, my name is Manny Quinn, and where are you today? And he said, I'm at Brown Mackie Hospital. And I said, what time is it? And he said, I don't know, must be nap time because it's been a little while since I've had lunch. Oh yeah, there's the clock. It's a little after 3. So he is oriented times 3. And I need to look in your eyes now, Manny. You turn over here just a little bit and look at me, and I'm going to do this, and I'm going to, his pupil constrict, and the other pupil constricts, and I do the same thing on the other side, constricts, and then this pupil constricts. All right, and look at the tip of my pen light, and I bring that into here, and both his pupils constrict. He is Perla at 3 millimeters. And somebody had a pen that has those on there. And so, okay, Manny, can you grip my fingers? He has equal grips bilaterally. And he has responded to what I have asked him to do. He can follow those directions. He can touch my hands. He has full use of his extremities. And I've asked him, I said, can you raise your foot over here to touch my hand? So I know he can move his lower extremities. And I said, do you have full range of motion in your hip with this leg? And he tells me that yes, he does. So I have, at that point, completed the neurological assessment for Manny. I'm going to look at his skin. And it's smooth. I'm going to look at his skin. He is nice and pink. His skin is not dry and flaky. The temperature, he's warm, not too hot, not too cold. The texture is smooth. He has no tinting in the back of his hand. I should have picked the other hand. No tinting on the back of his hand, which tells me he's well hydrated. And I'm not noticing any lesions or tattoos on his arms, and I didn't notice any on his legs. The same thing, and I will inspect his skin the rest of his skin as I move down the body. I'm going to look at his eyes again, because now I am just inspecting the eyes. And the lacrimal apparatus is pink and moist and without drainage. The conjunctiva, when I pull it down, ooh, that's creepy too. The conjunctiva, when I pull it down, is pink and moist. There's no edema, there's no crusting, there's no drainage. And the upper lid, there's no edema, there's no crusting, no redness in the upper lid, and the sclera is nice and white. Did I get all those things? I think. And he wears glasses, but they're just for reading, so he doesn't have them on. I'm going to look in his ears. I'm going to look in there. The canal is nice and pink. I see no drainage that's abnormal, any blood or any serous fluid that's coming from his ears. There's a normal amount of cerumen in there. I pull it up and out of the auricle. That's what the ear is called, auricle. They seem to be symmetrical and placed at the same level on both sides of his head, that there is no compromised skin integrity behind his ears, because he had sometimes had a nasal cannula, but since he's had his trach in, he's had the oxygen here, so he's good to go behind his ears. If I look at his nose, it is in the midline. It's nice and straight. It is symmetrical. I look up in the nares. He doesn't have a septum. This guy doesn't have a septum. The septum is that little wall between the nares. Sometimes that is deviated off to one side or the other, but his is transparent and it's nice and straight. But it's pink back there and it's moist looking. I'm going to occlude, I've got on gloves too. I'm going to occlude one nares and ask him to take a breath in and out. That nares is patent, and I'm going to ask him to do the same thing on the other side. And his left nares is patent as well. When I look at his mouth, his lips are nice and, well, they should be a little pinker, but his lips are pink. And I'm going to, oh, this is my favorite part, Manny, and I'm thinking it's going to be yours. Uh-huh. Yeah, I know. They always want you to stick your tongue out and say, ah. Okay, there we go. I'm going to put that in the side of his mouth, and I'm going to look at the buccal mucosa. I'll do the same thing on both sides. I look at the gingiva, and it's a little hard to see because he has full dentures, both upper and lower, but they seem to be nice and pink. His dentures are in good repair, and I'm going to ask him to lift his tongue and look under, man, too. Yeah, there we go. Tongue and lift in sublingual area. I don't see any edema in the salivary glands. It's nice and pink. He says he has no pain there. I can't see his hard palate because he has his dentures in. And so I'm going to ask him, does he have any discomfort under his upper plate? And he tells me no, he does not. Now I want him to stick his tongue out and say, ah, and I need my light, it's dark down there. Look in there, he says, ah, and when he does, the uvula vibrates. I forgot to say that earlier. And that's the response you should see.
That's a little piece of meat in the back.
That's that little punching bag thing in there, yeah. And I don't see, he's had his tonsils out, the back of his throat is pink, there's no redness, there's no drainage, and that seems to be in good repair. So, we know that about Manny's mouth. I'm going to palpate his tonsillar area, and I'm not seeing any reaction with frowns or grimaces that that's painful. He tells me that it does not hurt. I've palpated the sides of his neck down the edge and clear to the back of his friend. I don't find any enlarged nodes, and they don't seem to be tender at all. His pulse points are sure it is. What is that? Temporal. Yes, there it is. Lost 2 words today. Temporal pulse and his carotid. I feel temporal on both sides. I never want to palpate the carotid arteries at the same time. That would cause, it would include blood flow to the brain and he would pass out. So, but both carotids are palpable, his brachial arteries and his radial artery here. I'm going to palpate his radial artery on both sides. They seem to be equally paced and strong. His femoral artery, I'm going to ask him to lift his leg up, and when he does, right where his leg bends is where I am going to push down, and if I do, it's going to push it against the bone, and that's where I'm going to feel the femoral pulse. I'm going to palpate the popliteal pulse. Behind the knee, that's one that is very hard to find. You're going to have to practice that, and you're going to have to get skin on skin. Okay? And then there is the posterior tibialis is present, and he has a strong pedal pulse. That's his pulse. And while I was doing that, I also observed that his skin is nice and pink. It's moist. It's smooth. He has no edema. So his skin is in good shape. Okay. We've looked at his ears. We've done a lot here. Yeah, you know, all right, the vascular, I'm going to do capillary refill, and he has return in less than 3 seconds. His skin again is warm. The color of the skin is pink. He has no edema in his hands. He seems, if he makes a fist, he can make a nice tight fist. It's not one that's has a lot of edema in his fingers, and he can't make a nice tight because his fingers won't bend with the fluid. So, he has that, we've got